A novel prion disease associated with diarrhea and autonomic neuropathy. Definition: we describe a novel clinical and pathology phenotype associated with a Y163X mutation in PRNP, a disorder that is of particular interest for several reasons. The phenotype is distinct from another prion disease in that it is associated with a non-neurology presentation. The widespread deposition of the prion protein amyloid in the system organs, and slow disease progression, define and highlight the possibility that there are peripheral anomalies in another brain disease associated with a protein misfolding. Application in medicine. PRNP analysis should be considered in the investigation of inexplicable chronic diarrhea associated with a neuropathy or an inexplicable syndrome similar to familiar amyloid polyneuropathy. So here a video. So prion disease is an explication, the another syndrome like the Jacob, but the important here is to recognize what is the symptoms. Main symptoms: social withdrawal, insomnia, dementia, muscular pains, coma. Is the prion disease in neurology. In this case, is a diarrhea, but it's a little idea what is the prion. Okay. So continue. Pros: automatic failure and the peripheral neuropathy are no major clinical feature in the recognized inherent prion disease. It is likely that the cause of automatic failure in the predominantly peripheral, associated by the clinical and electrophysiological evidence and by evidence pathological features in the peripheral nervous systems. Diarrhea in this patient has multiple potential causes and may be caused by autonomic denervation of the bowel. So here another video.
Many times we're asked what a prion is. Throughout our body, we have proteins called prion proteins. These are normal proteins. They occur on most cells in the body and most organs in the body, and they are particularly abundant in the brain. What happens in prion disease is that the prion protein, which is a normal protein in the body, changes shape. When it changes shape, it becomes an abnormal protein. This abnormal form of the prion protein is called the prion. So the prion protein is the normal form, the prion is the abnormal form. And just as an example, if this knife depicts the normal prion protein, in prion disease, what happens is that the normal protein changes shape. It spontaneously changes shape into an abnormal form, the prion. So the normal form, called the prion protein, and the abnormal form, called the prion. What happens is, after one of these proteins changes shape, the abnormal form comes in contact with the normal one, and it transforms this into an abnormal form. So where we had one normal and one abnormal, now we have two abnormal. These now come in contact with two more normal proteins, change their shape into the abnormal form, and now we have four, and it becomes a domino effect, an exponential process. And in this way, the prion protein is transformed throughout the body into the abnormal form, the prion. And this primarily occurs in the brain. We're not precisely sure exactly what the role is of the normal prion protein, but we think it plays a role in protecting cells from injury.
So continue. Cons. Since the predominant symptoms are peripheral, patients often are referred initially at the gastroenterology and undergo gastrointestinal endoscopy and biopsy before a neurology opinion is sought. Thus, the condition is the challenging one to diagnose. The related contribution to observatory properties of pneumomutant protein prion, the lack of the GPI anchor and truncality of the protein, and associated between the 163X mutation and the presence of valin of polymorphic reduce the 129R unclear. Conclusion: the prevalence of symptomatic amyloid is associated with the prion protein probably low but might be better characterized with more widespread testing of PRNP and histology examination with prion protein in biopsy samples.